So, good day, ma'am. My name is Angel Pidator, and now I will show you my case study. So, um, dengue fever is an illness spread by the bite of mosquitoes infected with one of the dengue viruses. So, symptoms are usually flu-like but can worsen to severe dengue or the dengue hemorrhagic fever. So, a life-threatening condition, and getting infected a second time increases your risk of serious symptoms, and you can get vaccinated if you've already had dengue once. So, my patient's name is, or my patient's profile is, his name is Deja Mateo Opala, and he is 3 years old, in height 137 centimeters, and in weight, he's 17 kilogram, and his BMI is less than 18.5, or he is underweight. So, his status is single, and he is interested in singing, play toys, and watching movies. And also, his cultural background is Roman Catholic. So, in health status, diet history is meal pattern is less include beverage with meal or breakfast, fish, hot dog, and rice. So, in lunch and dinner, I can conclude, or I forgot to ask on her or on his parents about that. So, food preferences is healthy vegetables, and food intolerance or dislikes is none. So, food allergies is wala pud siya. So, in snacks between meals or bedtime is pancake. So, eating habits are regular. So, food restrictions related to religion, so no. So, chewing and swallowing ability is none. Types of assistance needed is to be able to help explore things, and methods usually to aid digestion and nutrition intake is none, and daily fluid intake is water and milk. So, in medication, allergies to medicine, wala. So, medication currently being taken, cetirizine Alnex or katong syrup, and Restime or katong chewable. So, trade name or the generic name is cetirizine Alnex syrup. Action of medication, reduce fever. Dosage, 5 ml. Time taken, once a day. And problem with taken, wala. So, normal la siya. So, Restime chewable, it can lower the temperature or fever. So, ang dosage niya is 1 liter. And time taken every after meal. So, problem sa pagtumar, wala. So, for child immunization status, complete immunized and as fully immunized. So, family history diseases. So, nobody in the family has a history of inherited diseases or other common health issues. So, in the environmental health history, so home environment is safe and clean environment. So, community, none. Work situation, none. So, psychosocial and cultural history, he experiencing sometimes a stomach ache, but he is active and smart. Yes. So, in the functional health patterns, so patterns of function, normal data, before hospitalization, during hospitalization, and analysis. So, first is the health perception or the health management. So, in normal data, eating healthy foods, and before hospitalization, avoid eating oily foods, and during hospitalization, eating healthy foods and fruits, and analysis is to render effective nursing plan. So, in nutrition, eating balanced diet. Before hospitalization, maintain. During hospitalization, is nibalik na siya normal. So, analysis is normal. So, in the 3, elimination, bowel, bladder, skin. So, constipated, white, have rashes. So, in bowel, normal. So, bladder, yellowish. Yahapong during hospitalization is yellowish, and iyahang analysis is effective. So, in the skin, have rashes. So, ang iyahapong before during hospitalization is na siya rashes na. So, during hospitalization, nag-spread na ang mga rashes. So, ang analysis is sign of dengue. So, in activity or exercise, normal. So, before hospitalization, is fat weakness, and during hospitalization is dizziness, and the analysis is lower resistance. So, in sleep or rest, 8 hours of sleep, before hospitalization, lack of sleep na. So, during hospitalization is normal na siya. So, analysis is normal. So, self-perception or self-concept, increased temperature, before hospitalization, having fever. So, during na hospital na siya is nagtaas na ang iyang hilanat, and iyang analysis is can lead to complications. So, relationship, normal. So, sexuality, normal sa tanan. So, coping, so no medicine taken. So, katong before hospitalization, taken medicines. So, katong na hospital na jud siya, na siya yung mga medicines, and ang analysis is to fast recovery. So, values or belief, normal na tanan. So, in the assessment, head to toe assessment, mental status, mood or of facial expression. So, he is a hyper and shy boy. So, ability of verbally communicate, oral, and intellectual ability is hyper. So, neurological status, level of consciousness, and level of orientation. So, both kay normal. So, in the pathophysiology, the pathophysiology of dengue fever include initial phase of dengue fever and other febrile viral illnesses. So, the virus is deposited in the skin by the vector Aedes aegypti or aegypti. Within few days, viremia occurs. So, lasting until the 4th day for the symptom to show. And progression, if lifted and treated, dengue fever most likely to progress to dengue shock syndrome. So, bites of Aedes aegypti, down to virus penetrates to the skin, to the virus infects and replicates inside the Langerhans cells, to immunity of the skin, down to Langerhans cells release interferons, or to limit the spread of infections, down to infected Langerhans cells go to the lymphatic system to make the immune system alert. So, down then goes to circulation, results in viremia, high level of the virus in the bloodstream, activation of immune response, and increases lymphocyte, and decreased neutrophils and white blood cells, down to release of pyrogen causes fever, and increased blood pressure in vessels causes rashes. So, down mo na din siya sa dengue. So, in the drug study, in the generic name, trade name, and form of drug, date ordered, classification, dose or frequency, mechanism of actions, indications, and contraindication, adverse reaction, and nursing responsibilities. So, ang yan generic name is the cetirizine Alnex syrup. So, date ordered, October 11, 2022. So, classification is systematic antihistamines. So, 5 ml. So, it is an anti-allergenic, anti-allergic that treats runny nose, watery eyes, and sneezing, and allergic rhinitis, urticaria, or the itchy and rashes. And cetirizine is contraindicated in patient with a no hypertensivity. So, ang adverse reaction is somnolence or headache, and dizziness, and dry mouth. So, nursing responsibilities, it is to monitor the vital signs, especially the blood pressure of the patient. So, second drug is the rest time or the chewable. So, date ordered on October 11, 2022, and it is anti-flatulent. So, 1 liter after meal. So, anti-inflatulent that changes surface tension of gas bubbles, allowing easier elimination of gas. So, ang young nursing responsibilities is to be able to know the action of indications they give, adverse reaction and nursing implications, and observe the 10 rights of medications administrations, and monitor vital signs, intake and output and monitor for the side effects. So, these are my nursing care plan. So, as you see, na-jud diri no tanan ang subject data, ang objective data, ang nursing diagnosis, inference, planning, intervention, scientific rationale, and evaluation. So, in this charge plan, his name is Dehan Mateo Opala. So, medication, so, give Alnex syrup 5 ml once a day in case the temperature increases and have a rashes, and give rest time chewable 1 tablet after meal to relieve discomfort due to the accumulation of gas in the stomach and intestines. And exercise, instruct to avoid excessive activities that may result to stress, and just advised to perform a range of motions and repetitive body movements for promotion of optimum. And in treatment, currently, no medications are available to treat dengue fever, and only to have a bed rest and increase fluid intake. So, in health teaching, so never stock a water in a container without a cover, and gallon container and tires must have a proper way of disposal, and use insecticides at home to kill or reduce mosquito. And follow up or the OPD check-up, instruct the family members to have a check-up or to consult physician once a while to monitor patient's condition and for detections of recurrences and other complications that may arise onto it. So, in diet, encourage nutritious foods like vegetables, meat, and fruits, and instruct the family members to give the client protein-rich foods such as meat, fish, eggs, and nuts. So, in vitamin K, such as leafy vegetables. So, that's all for my case study, and thank you and God bless.